Yes, sir. Go ahead.
I'd like to ask, do you know what the percentage of African American representation is in the clinical trial studies that you support?
So we were very intentional when we wrote the solicitation for applications for our clinical trials consortium, and we made a requirement for them to have at least 10% representation from disproportionately affected populations, which the majority of which are African American. They are overachievers, and so they have met or exceeded our expectations in every regard with that award, but usually they're around 15 to 18% of inclusion.
One quick question, if I may. Are your investigators supported by other agencies like NSF and NIH?
Absolutely, absolutely. Many of the investigators that we fund have funding from multiple sources, which is why sometimes at the end of the day it's difficult for especially federal funders to take complete responsibility for any accomplishments, because we're all really working together to move research forward. Yeah.
Yes.
Question to Dr. Harris. A statement. Number one, it's good to see the percentage of African American men in the clinical trial. And when I look at your 8.5 month survival rate, that's the highest that I've seen from any trial for advanced prostate cancer. And one of the things that may contribute to that, interestingly, is the number of African Americans. Simply because if you look at the Indian results, in their phase 3 clinical trial, they showed up to a 6 times greater benefit for African American men than for other men. So I'm happy to see that, and I love to hear how you've been able to accomplish that, number one. And number two, do you have any more insight on some of that data?
So one thing I want to caution is the results that I showed with the 8.5 month survival was a phase 2 trial. So it wasn't powered like you would power a phase 3 trial to show definitive results. And it is not uncommon to get slightly different results and sometimes majorly different results between phase 2 and phase 3 research. But nonetheless, we're encouraged so much that we invested in this 1,200 patient trial to try to confirm this and expand on the results. And also we changed our endpoint from a progression-free survival primary endpoint to an overall survival primary endpoint. Again, it's powered appropriately. And your points about African American men responding better to the Provenge is well taken, and that's the reason that we absolutely want to encourage as many African American men as possible to participate in this phase 3 trial, so that we will have sufficient numbers to definitively answer that question.
Any other questions? Yes, go ahead.
How are we doing with the recruitment of African American men with the treatment?
With the stand up to cancer?
Yes.
Could you repeat your question?
Yeah, she's asking how we're doing currently with regard to the recruitment of African American men for the stand up to cancer project that I just mentioned. And I don't have those specific numbers. In fact, maybe Tom, if you have those numbers.
Well, what I do know is that the recruitment began this year.
Right.
And the last time we had a conference call, people were collecting that data, but I have not seen any of that data yet. But certainly we're making sure that we work it out.
Other questions? No more questions? Okay, then that's going to conclude this session, New Developments and Evolving Trends. We'd like to thank our presenters, Dr. Harris, Dr. Best, and Mr. Kennedy.
I would, before we close, I've asked Harry Bass to talk a little bit, and we have a few minutes, Harry. You got a few minutes. Talk about your experience with prostate cancer.
Oh, okay. My experience as a prostate cancer warrior have been unusual, to say the least. In 2002, I had an insurance physical. Wanted to buy some more life insurance. And the results came back, and my PSA was elevated. Now, I already had symptoms of prostate enlargement. I hadn't ignored them, but I just did what a lot of guys do. I thought about the possibility that there was something going on that was not very good, and so I thought about how I could take control of the situation as well as I could, and I decided to approach it after I had the insurance examination and my PSA came back, I think, at about 5. I decided to approach it nutritionally. And for 5 years, from 2002 till 2007, I approached it nutritionally. And in 2007, it continued, well, actually throughout the entire period, it continued to go up a little bit. It got up to 9, and I said, okay, I think I better go and have this checked out. So I went and had a biopsy. 12 core samples were taken, 3 were positive, and they all had high Gleason scores, 7s and 8s. This would be considered high risk or aggressive. At that point, I took it real seriously, but I still made a decision to stay on course and add some things to my regimen nutritionally. So since 2007, I have been on a nutritional program, a very very interesting regimen. And I have been, I guess, actively surveilling myself and watchfully waiting myself, but being proactive at the same time. You see, I believe that our immune system is the first line of defense for all disease. And I think it is our responsibility as individuals to take control of our health and do some of the things that we think are necessary to improve, or let me say, to cut the chances of developing any degenerative disease. My feeling is that most degenerative diseases are lifestyle diseases. They occur to a great extent as a result of something that we're doing or something that we're not doing. And I think that we all need to understand that we have a responsibility to really take a close look at our own individual body health environment. We need to stay on top of it. We need to make sure that we're doing the kinds of things as far as diet is concerned to make sure that we keep these diseases at bay to the greatest extent that might be possible for us individually. So that's pretty much it. I'm still here, and I'm pretty darn healthy. One thing that's interesting about taking this course, there's a lot of stress involved. There's stress involved because a little thing happens, a little change in the way I feel. I get kind of nervous. But I think that that element of stress is going to exist with any choice that you make. And so we're all responsible for making those choices that we are most comfortable with. And so based on that, I'll just kind of turn things back over to Tom. Yes, got a question here.
You're actively surveilling yourself.
Yes.
That means that you monitor your PSA and everything else.
I monitor my PSA. I do it every 3 months, and I did not share with you what my PSA was the last time. It has continued to go up. My PSA was 20 at one time. It's now down to about 17. At one time, it dropped from 9 when I was strictly vegan and raw with respect to my nutrition. My PSA dropped from 9 to 0.2. Okay? So there's something to this. What it is, there are a lot of questions out there, but this is a real story. It's very true. It's very accurate. And if anyone has any questions, I'm happy to talk with them about a little bit more about what I've done. Thank you.
Thank you, Harry. Let's give him a round of applause. And I can vouch for the fact that he's here. I just touched it. Now, I wanted Harry to specifically talk about his experience and how he managed his prostate cancer, because in our consensus statement, in consensus statement 1, we state that men who are deemed to be at high risk, these are not men who have been diagnosed with prostate cancer, should be counseled about a wellness prevention program, including diet. And we even state in that consensus statement that men, even if they're not determined to be at high risk, should be counseled about a wellness prevention program. Because, it kind of stands to reason that if a good nutritional program or exercise can help you after you've been diagnosed, it certainly should be able to help you before you've been diagnosed. I know when I was in treatment for prostate cancer, my treatment center had a very intensive program on wellness, and the diet was a big piece of that. So I wanted to point that out. You know, we as Finn are certainly not advocating. I want to make this clear. We're not advocating that you do what Harry did. No. But we certainly are advocating that you go on a wellness prevention program. We think it's very important. And the other thing that we are going to begin to do is to incorporate in our outreach and education program more about nutrition. I know Reverend mentioned yesterday when she spoke, not only is she the executive director of the Health Commission for the AME Church, but she is a nutritionist, a dietitian, and she advocates that we follow some healthy eating programs. She even recommended that I eat more broccoli. And, I try to dissuade her from making that statement because I think I eat enough already. But we think this is an important area that deserves a lot more attention. And we plan, as we move more to our outreach, to really focus more on this area. So, Harry, thank you for your story. Yes.
The thing that I think is most important that I didn't say is that in front of being diagnosed with prostate cancer, an ounce of prevention is worth a pound of cure. And if you can do that with diet, if diet is a way that you might accomplish that, everybody should know a little bit more about it.
Amen. Before I completely wrap up this 2-day summit, I would like to say happy birthday to my mother. Now, my sister tells me that she should be tuned in watching. Tomorrow she celebrates her 89th birthday. And so, Mom, happy birthday to you. She was here at the summit, I think, at our second summit. And now she doesn't get out as much, but we love you, Mom, and glad that you've tuned in. Now, I would like to wrap up this summit, the 9th annual African American Prostate Cancer Disparity Summit, number one, by thanking all of our participants, all of the ladies and gentlemen and doctors and other people like myself who are not doctors. I want to thank you for your great presentations and your great contributions to the summit. I also want to thank all of our sponsors and for your great contribution, because without you, we would not be able to bring the parties together to address this issue the way we do it. And on the back of our summit program, you can see who those sponsors are, but we really appreciate your support. Now, in closing, I think that we've had 2 great days. We started off talking about an area that has to do with early detection of prostate cancer. I think we've made our point there. We've issued a consensus statement, and we're going to follow that consensus statement up with much more outreach on this area, much more education. We talked about a range of new developments in evolving trends yesterday and today. Yesterday, we also spent a lot of time talking about our community education and outreach initiative that we continue to grow, and we highlighted our faith-based partnerships. And I want to thank all of the churches that we work with. Your contribution and support are certainly integral to our mission, so we appreciate that. And today I thought we had just a tremendous follow-up. When we talk about active surveillance, when we talk about new tests new prognostic tests that will help us determine what we should do if diagnosed with prostate cancer. So I think these contributions will be found on our website on the Defend television. They will be a permanent part of our educational library. And so we are very, very pleased and thankful for everybody who supported and everybody who presented. So with that, I'd like to sign off of our 9th annual African American Prostate Cancer Disparity Summit and ask all of you to look for us next year for our 10th anniversary with the summit. Thank you very much.